Good morning all. I am Dr. Uma Maheshwari, Associate Professor in Prosthodontics. Today we will discuss on a topic called direct retainers. We all know that removable partial denture has various components starting from the major connectors, minor connectors, clasp assembly, indirect retainers and other forms of removable partial denture. But removable partial denture should include components that should mainly prevent displacement of all the processes from the patient's mouth during function. So, component that is very important in a removable partial denture is called a direct retainer that usually engages the abutment teeth, and we all know that an abutment teeth is nothing but a natural teeth that is going to be exactly adjacent to any missing or edentulous space. So today this discussion is going to throw light on the important concepts of direct retention and what should a direct retainer possess to actually function in a way that it is going to resist the dislodging forces that is going to act on a removable partial denture. So the outline of this discussion will be on the types of direct retainers, concepts of direct retention, the cone theory based on which the design of the direct retainer is modified, and discussions on infrabulge and suprabulge clasp, parts of a clasp assembly for direct retention, requirements of a direct retainer, classification of direct retainer, and ending with the summary and frequently asked questions. So moving on to the first discussion. So before we go into the topic, we have to know the types of direct retainer. So direct retainer basically can be broadly classified into intracoronal and extracoronal. So the term itself suggests the meaning of what is intracoronal and extracoronal. Extracoronal direct retainers consist of components that basically reside outside the coronal or the crown portion. So as you could see the picture that is there in the below the extracoronal in this flow chart. So you could see these attachments are placed entirely outside the coronal portion or the crown that is placed, which is going to hold the removable partial denture. Whereas when you go to this picture, you could see that two components are there, namely which is labeled as A and other one is labeled as B. So this A component has an attachment. You could see that it is incorporated into the normal contour of the tooth structure or the crown which is placed over the natural tooth. Likewise, there is a component that is going to engage this part A and which is cemented onto this part B. So this is called an intracoronal retainer and an attachment, and this is called an extracoronal retainer or an attachment. So the direct retainers are broadly classified into intracoronal and extracoronal. Moving on to the discussion of extracoronal retainers. Now we'll discuss what are the types of extracoronal retainers. So extracoronal retainers are again can be divided into two types, wherein you can see an extracoronal attachment as I said in the previous slide. So you can see the attachment here outside the crown surface. So what is the importance of these kind of extracoronal retainers and how do they differ from the extracoronal clasp assembly? So this attachment is actually designed to function as a stress breaker or stress directors. Now when we talk about the stress breaker or stress director, these are basically components that are usually indicated in class 1 and class 2 situations. That is class 1 Kennedy's and class 2 Kennedy's situation, where you will have a bilateral distal extension arch or a unilateral distal extension arch where the dislodging forces they rotate the denture, and to counteract that force we usually give an indirect retainer. But to avoid that type, another mode of to avoid the dislodgement due to the rotational force, we also give a stress breaker or a stress director in a form of extracoronal attachment so that the force is equally dissipated or vertically transmitted to the remaining abutment teeth and also to the remaining tissues. So that is the concept behind the extracoronal retainer as an attachment. So when coming on to the other type of extracoronal retainers, they are the ones that we usually follow or usually we indicate for a partially edentulous situations. So these are called as retentive clasp assemblies. So this is the most common method of extracoronal direct retention, and it was first appeared in literature when Bonville had described it in 1899. So this is the conventional or the traditional type of retentive clasp assembly that we usually indicate for the removable partial denture. So now moving on to the important concepts that we should know, or the terminologies that we should know before we go into the direct retention or how a direct retainer is designed. This theory was put forth by Prothero in the year 1916, and it is popularly called as cone theory. So this is how he described the cone theory. For his theory, he has considered the natural tooth to be in the form of two cones, okay, and the two cones approximated by a common base. So this premolar, which is near the cones that is displayed here, he considered a premolar or a molar to be in the form of two cones, you could see in this picture, and the dotted line, that is the common base, and this term was broadly described later by Kennedy. So this was called the height of contour. So for us to understand in a very simple way, height of contour is nothing but the greatest circumference of any teeth. So as you could see in this picture, this premolar teeth and the red dotted line and the black line, so that shows you the greatest circumference of that particular teeth, and that is called height of contour. Now why we should know this height of contour? So the next important concept behind this direct retention is, these are the two important points that governs how a direct retainer is going to act to give a retention to a denture.